So as the governor mentioned, we are this week looking at 11 counties. And as you can see on this slide, just like the one we reviewed last week, there's a number of data points that we've been tracking. We've been looking at a county's ability to provide testing at a level that allows us to feel comfortable with our ability to pick up positives when we have to and be able to contain that spread, our ability to look at overall disease transmission, our ability to look at the increasing hospitalization numbers, and then the ability of that hospital capacity in a certain county to manage those increasing cases. As you can see, in general, all of the counties have the capacity of ICU beds and ventilators that we need to continue to support the patients that are presenting and need that level of care. I think it's very important that, as the governor underscores the level of preparedness that we've had, that we want to ensure that as few people become sick as possible, and even though we have that capacity, that it's not capacity we want to use to treat COVID-19 patients. We would much rather people practice physical distancing, wear their face covering, practice good hand hygiene, stay home when they're sick, and all of the things we've been advising so those beds remain available but not used. I want to just highlight a couple of things on the table in front of you. Focusing on two new counties on the list, Riverside and San Bernardino, where we have over the past many days been in communication with those county public health leaders and leaders overall to have a conversation not just about the spread in congregate settings like skilled nursing facilities or even jails and prisons, but the fact that we're starting to see additional spread in community settings. So those are cases that can't be linked to necessarily a congregate setting that is spreading within households that live in closer quarters, maybe in communities where they have a number of multi-generational households, and where we're not just seeing that uptick in the number of cases as reflected in the case rate increases, but also in the commensurate hospital increases that we're seeing. So not only do we see increased cases in certain communities and certain counties, but those increased cases are not just because of increased testing, but actually becoming increased number of hospitalizations, and in the future may put pressure on our ICU capacity and our ventilator capacity that we want to maintain to keep our communities safe. I also want to identify Stanislaus as a county that is on the county monitoring list for the first time, and then continue focus on Los Angeles County, where despite a good job in maintaining their hospital capacity, doing quite a bit of testing, we still have a very high case rate, which we watch closely because of the dense population in Los Angeles County. A number of the other counties we've been following very closely. Imperial, which is a county we continue to be concerned about and talk about both in this Newsom at Noon conversation, but throughout the course of the week to make sure that we have the bed capacity, not just within Imperial County, but also in surrounding counties that have really stepped up and taken patients who've been sick in Imperial and need both hospital or ICU level care, so we keep all of Californians safe. So we will continue to update this list on a daily basis and share it with you every Monday so you can track with us those areas where we are concerned.